people that have the Delta variant, or people that get the Delta variant, even if they're unvaccinated, are spreading it at the same rate that, or even if they're vaccinated, are still spreading it at the same rate of unvaccinated people. They assume, they suspect. Okay?
Okay, I'll shut up now. Wasn't trying to aggravate you, just didn't want foaming at the mouth wackos to jump down your throat yet again. You do good work, the left needs more people like you. Thanks.
You understand? CDC's out with new data showing how much more contagious the Delta variant is. We've talked about this yesterday, but we'll cover it again.
Boston Children's Hospital, Dr. Brownstein, good morning.
Quickly.
It's always great to have you. So the CDC, as we mentioned in an earlier report.
And how do we help people who have a valid distrust in the medical system? I don't think the fucking distrust in the medical system is valid. You don't distrust the medical system. You don't like the capitalist for-profit part of medicine, okay? No one is like, I fucking hate doctors, bro. They heal people, and I fucking hate it. Everyone's like, I don't like the fact that dentists, for example, is a great example of this. Dentists are basically like fucking car salesmen, dude. It's crazy. You know what I mean? Like, everyone is so profit driven that they're just constantly trying to pump you full of shit and trying to add like as much as they possibly can. You go to the fucking optometrist, and they're like, oh, you definitely got to get a fucking really eye checkup, like at least twice a year or whatever the fuck, right? And it's the profit driven attitudes that people have that is a problem, okay? Not the fact that like dentists are doing incredible work in general, or doctors are doing incredible work in general, okay? No one's like, dude, I fucking hate that these guys are like saving our lives. You probably don't feel the same way about firefighters, okay? Which is a completely socialized institution. It didn't used to be. But like, there's a reason why you're not like, dude, I fucking hate firefighters, dude. They're such scumbags. They're always just like, you know, they're always just trying to fucking start fire so they can put it out. No dentist telling you to rip out your teeth or perform root canals for no reason. No, I agree. I was talking about like teeth cleanings and like all the additional like bells and whistles that dentists like offer on top of everything else. It's just like, unfortunately, it's kind of it's a little bit scammier than other parts of medicine. But the point I'm trying to make is that it's not what dentists are doing that is a problem. It's not that like dentists, you know, dentists selling you on additional fucking work that like over trying to upsell you is not the issue, or dentists upselling you is the issue, not necessarily the fact that they're like taking care of your teeth. You understand?
They're out with that new data showing how much more contagious the Delta variant is than other variants, comparing the transmission to viruses like chicken pox. Help us understand what that means and how much of a game changer is this information?
Yeah, well, good morning, Whit. We do have to acknowledge Delta is serious. It's way more contagious than any other variant that we've seen. It's possibly more severe. And we are learning that, you know, you may be able to transmit if you are symptomatic and vaccinated. And the data from Provincetown is concerning on viral loads and breakthrough infections. But we have to remember, it may not be the norm. We do need more studies to characterize how likely these breakthrough infections can transmit. And we especially don't know if asymptomatic cases can spread. So clearly a lot of fear and anxiety, but the good news is we have a way out. You know, Provincetown would have been way worse without a vaccine. And we know that the case for vaccine is so strong. We see that 25-fold reduction in hospitalizations and deaths with vaccination. And that's really why we're starting to finally see an uptick in vaccinations across the country right now.
You mentioned that report on Provincetown, and I want to go back to that because it also shows that, as you said, vaccinated people can still get the virus and spread it to others, although symptoms much less severe. So what's your message then to those who already got the shot and those who are still skeptical?
You know, right. The biggest challenge right now is countering this perception that the vaccines aren't working because of these breakthrough cases. Crucially, these vaccines are working incredibly well at preventing severe illness and death. So if you're vaccinated, overall, you should feel very good. Of course, for immunocompromised people, there's still this concern that, you know, immunity may be waning and the booster shot may be important. If you're unvaccinated, you know, the urgency is there. If you're on the fence, please consider getting this vaccine. You know, the surge right now would have been way worse if we didn't have half the population immunized. So we have to really get vaccination up in this country if we're going to counter this Delta variant.
The CDC again recommending masks indoors in places of high transmission, also in schools where many kids still aren't eligible for a vaccine. Is that the direction we're heading in now? More mask mandates even for the vaccinated?
Yeah, well, we have to remember, the unmasking came during the Alpha variant, and now we live in this Delta world. And, it's a reality of where we're at. We're seeing, numbers of cases about the same as where we were last year. Generally speaking, I don't think we're going to see universal mask mandates, but I do think targeted interventions are going to be super important. Masking in schools, especially in areas of high transmission, that's going to be important to keeping our kids in classrooms. But overall, it's going to be about targeted, flexible, nuanced interventions, community by community, and making sure that we're controlling surges, to really reduce risk to those that are unvaccinated and, of course, our vulnerable populations.
I don't have much time on this last one, but the FDA now permitting preventative use of the monoclonal antibody cocktail from Regeneron for certain people who have been exposed to COVID-19. From a practical standpoint, how could this treatment be used?
This is a really good point. I think people don't understand that the profit motive of Big Pharma isn't driving them to have 100% vaccination rates. Herd immunity prevents that, or herd immunity is the reason why people want like as high as a vaccination rate as possible. Thank you, Emmett K2. You are absolutely correct. That is the real reason why people want as high a vaccination rate as possible. But people assume like, oh, dude, Big Pharma wants everyone to be vaccinated for their own personal profit, and like they put out a shit vaccine that like, makes you go gay or something.
I've got
before someone gets infected.
Yeah, this is great. Therapies are not necessarily part of the conversation, but especially this FDA recommendation is especially valuable for those that are immunocompromised and can't mount an effective response. I think being able to bring those therapies into...
Do you expect the festivals to be canceled at this rate? Yes. Seeing how things are popping off right now.
9 months ago, I never thought I would lose my
if we don't
COVID.
fucking
we need to keep up with the science,
look,
otherwise we will have the ligma variant.
Here's the thing.
Your channel
if everyone is fucking vaccinated
for this past year, thank you for
then
what you do, Hassel.
One, even with the Delta variant, unless there's yet another mutation and another variant that's like even more deadly and devastating than that one, if everyone's fucking vaccinated, or if we have herd immunity, or if we have like a significant percentage of the population vaccinated, like 80%, I think that was the original thing that they were trying to reach, the original goal. Then this virus, this COVID virus in general, basically turns into the fucking common flu. Okay? Less deadly than the common flu and the influenza issues that occur during flu season every year. Like, it's not even the fucking common flu. It's like a cold, but like more annoying because you don't have your taste buds. You can't fucking taste shit. Is like the most common symptom. So if that happens, then yeah, nothing needs to be canceled. Okay, it's still terrible for immunocompromised people who are genuinely worried. But from what I understand, as long as you're fucking vaccinated, even if you are immunocompromised, like you're protected to the same degree, if not higher, actually, not even to the same degree, higher than you would be during flu season. What do you think of the rationale of people that give out COVID vaccines but refuse to get it themselves? Yeah, I don't fucking understand it.
To surges, because vaccines take a couple weeks to take effect. So having these therapies could actually control a surge ahead of sort of this increase in vaccination in the community.
A new scientific development in all of this. Dr. Brownstein, as always, thank you so much. We appreciate your time.